Hi, my name is Dr. Andrea McSwain, and I want to talk to you today about the kyphosis or rounding that often happens as people age or use the computer too much or even are involved in gaming. And so what happens is this can really contribute to respiratory problems and cardiovascular problems, including compression on the thyroid. And so I want to talk to you about how to reduce that for yourself and for your loved ones. So basically, in your armpit, you have a keystone ligament called the pectoralis minor. Pectoralis minor attaches to the inside of your shoulder blade or scapula and connects to ribs 3 through 5. So right about here and inside here. And as it does, it tightens, right, with rounding, and then it pulls the shoulder blade off the back, closes up the upper lungs, and it makes it very tight here. Now, sometimes as well, elderly people are at risk for having problems with swallowing because they often will do this, and then they will open their mouth to eat, and when that happens, they can get some food, and it can possibly go into their lungs. And so this is really important because that can increase your risk for pneumonia as people age. It's very painful in this area. It also increases your risk for an upper respiratory infection and all the other things as well. You can imagine the strain that goes on into the carotids. So what you do, basically, and this is important too if you do this to someone else, is think about that this arm bone is, most people, it's rolling in. And so the first thing to think about is can you get this arm bone to actually roll out and set more in the middle? A lot of times people are anterior in this bone. And so this bone actually seats into a socket. That socket has the top of this bone in it. Now that socket can be anterior. It's rarely ever posterior because you have a shoulder blade there. What you have here is a series of ligaments that can thicken and be protective. And that's what happens. Sometimes people will tighten, and as they do, they take the ligaments here, or the connectors, and they end up rolling this arm bone. So it rolls in, it gets very, very tight, and then that contributes as well to the hunch. This is extremely easy to fix with amazing results, and it can be done very, very quickly. So basically, what you want to start doing is taking your hand, just like I'm doing here, and pressing into this place, and what you will find right about here is it almost feels like a cord, like a rope. And so when you find that, that's really where you want to press in and rub. Okay, and as you do that, or someone's doing that to you, think about rolling that arm open. And so rolling that arm open will then allow this to lengthen. This is done very well, actually, also laying down. But you can do it and see the results when you're sitting up. It allows it to lengthen. The shoulder blade comes on the back, and then this part releases. This part releases. The arm is this way, and the hand also will go with the palm open is what your goal is. So that's actually the natural resting position, is the palm to be up. So this is the psoas minor, this is the pectoralis minor. It's a keystone ligament in communicating what should happen to the upper extremity. It's meant to be protective, and it can tighten and roll everything in, and then people roll in and they hunch, and then they look up like this. And in very, very severe cases, many people have seen this extreme rolling forward, and then people will look up or they'll look down, as well increasing their risk for falls. Thank you very much. I hope this helps. Please leave a comment or a question. I'd be happy to answer. Have a good day.